There's a great deal of anxiety in our community regarding the coronavirus, otherwise known as COVID-19. So I want to take some time to at least let the community know what we're doing in Broward County and give an update, because I believe with more information, folks may be calmer. And we really don't want folks to be stressed out. Although new information is coming out daily, the State Health Department maintains, and we continue to believe, that the risk to Broward County's residents remains low. But public interest and concern is high, and there are lots of misinformation out there. This should be a period of calm and readiness, as we rely on the strong collaborative partnerships we have locally to meet these challenges. Today, we've brought together some of the teams of people who are working to keep our county safe and to help you separate fact from fiction. With us, we have Dr. Paula Taki, Florida Department of Health, Broward County, School Board Member Donna Korn, Sheriff Gregory Toney, myself, my colleagues are here also, Commissioner Barbara Sharif, Commissioner Michael Udine, the Mayor of Fort Lauderdale. This is a team effort to keep our community safe. So let me take some time to talk a little bit about this issue that we face. Currently, there are no cases of coronavirus in Broward County. And there are no plans to close school or cancel public events. I want the public to be aware that the symptoms are similar to the flu. So if you're sick, stay home and follow the advice of your healthcare provider. It's been said many times, but wash your hands regularly with soap and water for at least 20 seconds. Use hand sanitizer at home and in the workplace. Cough and sneeze into your elbow, not your hands. Avoid touching your eyes, nose, and mouth. Avoid close contact with anyone showing the symptoms of respiratory issues. Again, I really want to stress, there are no cases of coronavirus in Broward County. However, we're not taking any chances. We're ready to support our community if the challenge arises. We must rely on our experts, and we're blessed to have some of the best doctors in the country that live right here in Broward County. Some of them are here with us today. The county is being proactive to prepare for any potential coronavirus presence in our community. We're stepping up our cleaning of public buildings, particularly in areas that the public does business with the county. As an example, airport cleaning crews are doing more thorough, more frequent cleanings in bathrooms and escalator and on railings. There are ongoing inspections in county buildings and public educational material directed at prevention has been placed in every bathroom and facility. Our transit fleet is being thoroughly disinfected every day as buses return for the evening. And workers are cleaning high-touch areas more frequently, including on our paratransit buses and vehicles. Public information and preventative measure is being placed throughout the system. Additionally, we have reached out to the municipalities or cities, and will continue to coordinate the sharing of verified information with them. We're taking steps to take care of our employees, ordering more resources to prevent the virus. As we take care of ourselves, we're preparing to ensure that if anything happens, we can take care of the people of Broward County. At the Fort Lauderdale Hollywood International Airport, Customs and Border Patrol is continuously monitoring passengers in our facility, looking for anyone displaying symptoms. If they are, they may be detained or isolated, and will contact the Centers of Disease Control and Prevention. They'll also look at passengers' travel history. It is important to note our airport remains fully functional. At the port, cruise lines are requiring all passengers to complete a declaration form before being allowed to board a cruise. While each cruise line's policies varies, each has applied a combination of denial of boarding for cruise and passengers originating from certain locations around the world, and mandatory health screening for passengers originating from other locations. The port's website has links to the cruise line policies and is the best source for this information. You can visit our port at porteverglades.net. That's porteverglades.net. Should it become necessary and requested by the CDC and Customs and Border Patrol, the airport and the port have the capability to easily augment screening. It is safe to travel, but evaluate your travel plans as conditions warrant. Rethink traveling to areas that are already under travel advisory or areas that are experiencing an outbreak of coronavirus. I encourage you to monitor the CDC for the latest on travel restrictions. Follow expert guidance and have accurate information are the best defense against COVID-19. There are many resources available. The county has established a website, broward.org/coronavirus, with helpful links. At this time, I'd like to have Dr. Tachi, head of the Department of Health in Broward County, come forward.
Good afternoon. The global outbreak of the respiratory illness called COVID-19, caused by the novel or new coronavirus, continues to expand. As the mayor reiterated, there are currently no confirmed cases of COVID-19 reported in Broward County at this time. With that in mind, we all understand the concerns that many of us feel about the situation, and all of us are here to provide you with the most updated information to protect yourselves and your family, and also to tell you what we are doing to protect our community. We have successfully faced public health challenges in Broward County, like Zika and the 2009 H1N1 pandemic, and we will face the challenge of COVID-19 together. On March 1st, the Florida Department of Health reported Florida's first 2 cases of COVID-19. As a result, the governor issued Executive Order 20-51, and the state Surgeon General declared a public health emergency. Symptoms of COVID-19 include fever, cough, and difficulty breathing. COVID-19 spreads through respiratory droplets when an infected person coughs or sneezes. It is mainly spread through close contact within 6 feet of the other person. The period between exposure and the development of symptoms is 2 to 14 days. Currently, there is no vaccine or approved treatment for COVID-19. If you think that you may have been exposed to COVID-19, especially through travel, in the last 14 days to identified areas and countries such as China, Iran, South Korea, Italy, and Japan, or through close contact with someone who is a confirmed case of COVID-19, please immediately self-isolate. Please call your healthcare provider and call the Florida Department of Health in Broward County COVID-19 call center at 954-412-7300 before traveling to see a healthcare provider. If indicated, the Florida Department of Health in Broward County will work with your healthcare provider to get you tested. The Department of Health Bureau of Public Health Laboratories is currently performing testing using test kits from the CDC. Commercial testing is not available today, but the situation is rapidly evolving. All of us can take everyday actions to help prevent the spread of respiratory illnesses such as COVID-19, and they are worth repeating. Washing hands frequently with soap and water for at least 20 seconds, and if not available, using an alcohol-based hand sanitizer with at least a 60% alcohol content. Not touching your face, staying home when you're sick, and avoiding close contact with people that are sick. In Broward County, county government, the health department, all of the partners represented here today, as well as many others, work together on a daily basis to protect, promote, and improve the health of our community. This was recognized when Broward County received the 2019 Robert Wood Johnson Foundation Culture of Health Prize. Under the leadership of Broward County Emergency Management, we plan, train, exercise, and respond together on a regular basis to be ready for such events as COVID-19. Working with our partners, the Florida Department of Health in Broward County continues to take the following actions: reinforcing important prevention messages for the public, monitoring the health trends of our community on a daily basis, actually on a moment-by-moment basis, to detect any potential cases of COVID-19, providing expert consultation to healthcare providers and the public on a 24/7 basis, coordinating the collection of specimens or collecting those specimens ourselves and making sure that they're transported to Bureau of Public Health Laboratories for processing, monitoring any individuals as required. Should it be necessary, we are prepared to investigate any cases, trace contacts, and take any containment measures that are required. We are continuing to provide the most updated guidance to all of our community partners, including hospitals, healthcare providers, long-term care facilities, educational institutions, businesses and employers, and first responders, and helping them to implement that guidance. The Florida Department of Health in Broward County is working with our partners to prepare and ensure that local plans, resources, and capabilities are in place so that we can respond and minimize the effect to our community should there be a widespread outbreak of COVID-19. As you know, this situation is rapidly evolving, and the most updated guidance can be found at floridahealth.gov and cdc.gov. Thank you.
Thank you very much. With School Board Member Donna Corn, I believe you're the chair now, right?
I am.
Yes, chair of the school board.
Thank you. Good afternoon. My name is Donna Corn. I am the chair of the Broward County School Board and countywide school board member. I'd like to take this time to thank the mayor and the Broward County Commission for bringing this collective message together. The school district has been monitoring the coronavirus since it was first recognized, and our teams have been meeting regularly to ensure the district is prepared. The health and well-being of our students, staff, and school communities continues to be our focus. We're following guidance from the Florida Department of Health and Centers for Disease Control and Prevention. We're emphasizing awareness, prevention, and preparedness in all of our communications, which include website, social media, Beacon TV, parent links, robocalls, and newsletters. The district is encouraging our students, teachers, and staff to wash their hands frequently, cover their mouth and nose when they sneeze or cough, and stay home if they are sick. We are conducting extra cleaning at high-frequency contact areas with a germicidal disinfectant, including our restrooms, doorknobs and doors, countertops, drinking fountains, and sinks. We're ensuring schools and district departments are adequately stocked with hygiene supplies such as hand sanitizer, soap, and towels. Posters have been placed in our schools and our departments that reinforce the importance of hand washing and infection. In addition, counseling is available for students who may have anxiety about the coronavirus. We recently updated our guidelines for students, teachers, and staff. The Surgeon General has advised those planning to travel outside of the United States, specifically to high-risk countries, to self-report and to self-isolate. The 4 high-risk countries are China, South Korea, Italy, and Iran. To minimize exposure to our schools and district, students and staff who visit these countries are asked to self-report their trip to their school principal or to their department leadership, and to self-isolate for 14 days upon their return. During the 14-day isolation period, individuals who develop respiratory illness with symptoms of fever, cough, and shortness of breath should immediately report to the Florida Department of Health, Broward, or their healthcare providers. To ensure that learning continues during this period, instructional materials will be accessible to all students who are homebound. In addition, there will be no approval of future out-of-country school field trips. Currently, there is no restriction on domestic travel. As we continue to monitor the coronavirus, we are providing updated information and resources on our district website to keep our families and communities informed. The website is browardschools.com/coronavirus. Thank you very much. Thank you.
Thank you. Sheriff Tony?
Yes, sir. Good afternoon, everyone. Thanks to the commission as well as the mayor for organizing this press conference. As you've heard already, there's been a lot of information provided to the community as to safeguard measures that we can take to ensure we're not contaminating ourselves or family members, and it's an important message. I bring a little different message today. Of course, we are in compliance with all those recommendations from the CDC. All facets of our organizations, from our Department of Detention to our Fire Rescue and our Law Enforcement Department, are all cautiously aware of some of the things that could impact us as we're out and serving the community. But it has not slowed us, not for a second. We are prepared to handle anything that may come up. One of the things that we have recognized, and I want to share with this community, we've been getting a lot of information coming in related to opportunists. Unfortunately, anytime there is a fear that is introduced in this community, in this case, we're dealing with a potential virus, we found folks out there who are trying to gain financially on this. And there has been a lot of scam artists who have created websites and platforms going onto the social media world, targeting our elderly population, making commentary that there's a cure for this particular virus. And so what we want to do is advise the community on a couple of things. One, there has been no indication or anything produced from the CDC or any other medical body or professional organization that suggests that a cure exists. So if you are receiving emails, if you are getting things on the social media platforms that are advising you or encouraging you to enroll or to purchase such items, it is non-existent. In addition to that, we've noticed that over the last few days or so that there has been even formats of mailers and things that are going out into certain parts of our community that are, again, suggesting that we want to introduce some type of procurement of different vaccines or medication. None of these things are truthful. We want to encourage our community to report these things into our organization. Our investigative bodies are prepared to follow up, and I can assure you as a sheriff, any participating criminals out there or folks who feel as though they're going to prey and take advantage of this moment, we will pursue all criminal elements and ensure that we hold people accountable. This is not a time for our community to suffer any added fears or to focus on should we be able to purchase items and lose money. We need to combine ourselves here and make sure that we're not focusing on things that are non-essential. Right now, what we need to do is to continue to monitor and track our Florida Department of Health in terms of the recommendations that are coming out. They're the medical experts behind this, the things that are coming on the national platform from the CDC. But from the agency standpoint, rest assured that BSO is very much competent and prepared to handle and partner with all our different organizations, as we already are doing. Of course, we are working with our ports, our airport personnel, in terms of any type of emergency quarantine or isolation things that may have to take place. We'll be ready to respond. So I just want to share that. In addition, we put out a press release related to those items of awareness related to the scam. Please go onto our website at sheriff.org. Pull up the bulletin, look at all the different details and bullet points that we highlighted for your awareness. And if you have something to report, you can report it to our non-emergency line. Thank you.
Thank you, Sheriff. You know, this virus is teaching us that as humans, we are interconnected, no matter where we are in the world. And as such, it takes a collaborative effort to deal with issues similar to these that affect us as humans. That's why we've assembled the people who always work to help ensure that Broward County is a safe place. And let me assure the public that Broward County is doing whatever is necessary to meet this community challenge. Just as we start each hurricane season, this is not a time to be filled with fear, but is a time to take precautions, be prepared, and work together. Stay informed and stay healthy. I have with me also others, Mike Nonamaker from Fort Lauderdale International Airport, Mr. Glenn Wilshire from our port. We have Dr. Randy Katz from Memorial Health Care, and I know that there was representation here from the city of Tamarack and also from Miramar and North Lauderdale. Let me thank you all for being here. We have some moments for questions if you choose to have some.
I know that you said that there were cases, but is there any idea as to how many kits there are in South Florida?
And so when we receive calls from healthcare providers or from the public through our COVID-19 call center, we evaluate each of those calls and information on a case-by-case basis, and we arrange for testing as indicated.
A surge of calls into your call centers right now?
We had about 50 calls yesterday.
Identify somebody, do they have to go to a hospital? Like, where would they go to get tested?
So that would depend on the details of the individual case with regard to the medical status of that individual patient. Generally, testing could be conducted by a healthcare provider and could also be conducted by the Florida Department of Health in Broward County, depending on the individual circumstances.
Are there enough kits for the amount of people calling and asking to be tested?
We have been able to conduct such testing in all cases where it was indicated.
What goes into testing? How does that work?
There is an oropharyngeal swab and a nasopharyngeal swab that is collected, that is put in viral transport media, that is packaged according to specific guidelines, and then is transported to the Florida Department of Health Bureau of Public Health Laboratories.
And you're not able to give us a number on the kits?
As I said, we have been able to provide testing in all cases where it was indicated.
Any idea how many cases have been indicated?
The Florida Department of Health website, floridahealth.gov, provides the latest information with regard to cases in Florida.
It's a surge tomorrow. Would you have enough kits to test?
Again, we evaluate on a case-by-case basis. Testing is currently available at Florida Department of Health Public Health Laboratories. It is not available today at commercial laboratories, but the situation is rapidly evolving.
Sheriff, about price gouging, do you have any information about that?
Well, not necessarily about any price gouging aspect. This isn't the environment where we're dealing with perhaps in a hurricane where we have issues with gas. But again, going back to what we're seeing is these criminals out there who are taking advantage of, there's an induced fear about a virus that's been all over the national and international news. And so they're creating these scams and patterns and making these kind of robot calls and introducing these different things on social media platforms. And as they're coming in, you know, our threat management division, our real-time crime center, our investigative branch are seeing these things. So it's incumbent on us to educate the public as to, look, this is a crime, this is fraudulent. There's nothing that documents out there that there's a vaccine or anything that someone should be buying for $79.99. And so I don't want our public to take these fares on and start making procurements and losing money because it will roll into other crimes. It may be an individual purchase today, but now we're dealing with credit card fraud 6 months from now, all spawned from a fear that's really not necessary.
Question. With regards to the early voting that starts, I believe, tomorrow, what are the preparations for the sites like, for example, in Miramar, we have the library. Are there going to be, you know, hand sanitizers? Are the machines going to be wiped down, et cetera?
The supervisor of elections has indicated that early voting continues and that provisions for hand sanitizers and sanitizing the areas where people are frequent that will be done. So at this point in time, there's no issue there.
For,
Difficult enough for the general. I'm assuming for the county and all the extra cleaning you guys are doing, has it been difficult to even get those supplies?
At this point, we've not had any issues with receiving supplies.
for items coming from China and then the other countries that were named, can the port just kind of go into detail as to how they screen for products and accept products into the country?
Yes, the port trade routes are mostly north-south, so we do not have any ships that come directly from China or from Asia. So we're not have any need for screening because we don't have any commerce coming from those areas of the world.
Coordination between the county, the hospitals, and the nursing homes in Broward County.
So at the staff level, we work closely with them. Dr. Tachi has been quite open and available for us. The hospital district, as you see, is represented here. So let's compare this to a hurricane. When that happens, we all are working together, and that system exists. We're here in our emergency operations centers. We're used to working together to deal with issues that face us in Broward County.
We've been covering a lot of information about events in Miami-Dade that have been canceled or, abbreviated to some degree because of coronavirus fears. Is there anything upcoming here in Broward County that is either being looked at this point as a possible event that could be canceled or changed in some way?
We haven't done that. There's none of that is being done. Again, let's be clear. There's no cases of coronavirus in Broward County. Of course, we want to be cautious, but we ought not be crippled.
Has the Department of Health or anyone put a certain protocol into place when someone, let's say, goes to Broward Health Medical Center and says, I have these symptoms? What's the protocol? Is there a protocol in place for all hospitals, or is it just fend for yourself, each hospital does its own thing?
So the CDC has very specific guidance for healthcare facilities with regard to these issues, with regard to infection control. Myself and other expert staff at the Florida Department of Health in Broward County have met with every acute care hospital in Broward County, and they are all implementing the appropriate screening questions as well as the appropriate protocols with regard to suspected cases of COVID-19.
Are there people in Broward County that are being monitored right now?
So all of our 67 county health departments in the state of Florida monitor folks as indicated.
Descriptive about that, only because we are getting questions nonstop from our viewers, and that's why we continue to ask you the same. Is there anything more you can say about, people being monitored, how they're being monitored? Are they being kept at home? Do they check in with the hospital? Kind of, how does that work?
That would depend on the individual circumstances and why folks are being monitored. For example, if they are asymptomatic travelers to any of the countries that we named, they are asked to self-isolate and then report to the county health department if they call the county health department if they develop symptoms.
People are being monitored in Broward County right now.
Yes.
You just can't tell us how many?
So that number certainly changes based on the circumstances, and all of the appropriate criteria and monitoring protocols are being followed.
Dr. Randy Katz, would you like to?
Yes, in Memorial Healthcare System, we're working closely with our first responders and the Department of Health to ensure that any patient that enters the hospital is appropriately screened with the screening questions the CDC recommends. We're trying to cohort those patients into certain areas, but at the end of the day, it's really about early identification of a high-risk patient. And again, we're working closely with our first responders, patients that walk into the hospital, asking the appropriate questions out in triage before they enter the hospital and expose the population. So we are taking all of those precautions. And remember, we've done this before with many other viruses, H1N1 in 2009. We have experience, and this is something we've done before. So this is not something new. And as the mayor said, I think we need to make sure that the public is aware that, we are taking all the precautions we need to take, and we're providing the support that we need to take from a healthcare standpoint.
As a doctor, when people see this story today at 5 or 6, as a doctor, what's your core message to the viewer that says, how do I prepare and, just kind of...
Yeah, I think there's a lot of questions the public has with regard to symptoms, and if you're unsure, as Dr. Thack, you mentioned, there's a Department of Health hotline you can call. I encourage people to use telemedicine. Memorial Doc Now is one option, but there are many telemedicine products, and if you're not sure, you can always contact a physician via telemedicine. So there are ways to reduce exposure, but common sense prevails, and just like the flu, if you're young and healthy, this virus, essentially transmits through contact with other people. So protect yourself, your family, and try to avoid exposure to public places and hospitals if you don't have comorbidities and you're not suffering from lung disease. So really just using common sense and proper precautions at home.
Question.
That's the last one.
Just in my circles, I've talked to a lot of people who have canceled a lot of trips, who are self-isolating, whether they're sick or not. Is there anything that the Chamber of Commerce here in Broward County is doing to try to, I guess, mediate anybody who's not traveling here because of this?
Well, the message is clear. Today, there's no identified case of coronavirus in Broward County. I want to make sure the public understands that. We're not canceling an event. Yes, we have to be cautious, but we're not going to be crippled. We're going to go ahead and ensure that we continue to be productive, using every bit of caution that we can and being as prepared as we can to ensure that we avoid any real situation where transmittal could occur in Broward County. I want to thank you very much for being here. Have a good afternoon.